Hi, I'm Marcus from Hambledon Rehab, and today we're going to be looking at some core activations specifically for low back pain. Today's movement probably does have a name. Unfortunately, despite trying to research it again, I've been unable to find it. So we'll just call it a core activation. What we are going to do is make sure that you know how to brace your core before we do this movement. So the movement's going to be done laying down flat on the floor, and we'll cover that in a second, but I want to make sure that you're aware of how to brace before we do this. We refer to bracing an awful lot when we're doing core activations. And if you've never really been shown how to brace or what bracing is, then you're unlikely to know. So what I want you to do is place your fingers on the edge of your abdomen, kind of where your six-pack muscles would be. Even if you've never seen them, just kind of, you know vaguely where they are. You're going to pop your fingers just in there. And then I want you to give me a little cough. Very contentious in this day and age, but it will get you to feel what your abdomen bracing feels like. All you need to now do is mimic that sensation, formulate the same kind of sensation by bracing the musculature. You need to be able to breathe while you're doing this. It shouldn't feel uncomfortable in the slightest anywhere in your body, and that's how to brace. So for now, we are concerned with everything from the inguinal ligaments here and the lower ribs here. Now obviously our core goes all the way around the back, and we'll be monitoring all of that, but principally we're going to feel it here. So our rectus abdominis, or six-pack muscles, come down here. Just to the side of those, there's normally little dimples, even if you have to push through a little subcutaneous tissue. We're going to take a breath in and then cough. You can feel that tension that you maintain with the cough all the way around. And actually, if you go into the back as well, you can feel that all around there as well. Now, as you can hear, I'm still breathing and talking, but I'm holding that brace. Okay? As with all drills, please monitor your own body. Listen out for any aches, pains, or any discomfort anywhere in the body, not just in the area being worked. Also look for changes in your breath, either in depth, pace, or sound, as this will provide you with information about where specifically in the movement to target your rehab work. Okay, so we're laying down comfortably on the floor, and we're going to start at the head. So we're in a nice tall spine. So we're extending out the very top back of our head, pushing that up along the floor, and the chin is going to tuck as a result because we're turning about the ears. So this is our point of axis. So we tuck that chin in. Nice and relaxed through the shoulders. Arms down by sides, thumbs up. Then we're going to rotate round so that our little fingers are on the inside. We're then going to take our shoulder blades here down towards the same side hip. So thumbs round down. We're then going to look at the legs. So we're going to do the bent leg. I'm going to do it on this side. I'm going to demonstrate on this side to begin with. So bent leg, this is going to help us stabilize the pelvis. We're going to rotate, we're going to screw the foot into the ground. So rotating round here in the lower leg, which is going to help us screw that little toe into the ground. So I'm going to swap and do it on this side, and I've shown you. So screw that into the ground. Then on this leg, we're going to lift the foot. We don't need to lift the toes particularly. In fact, we want the toes to be nice and relaxed, but we are going to push the heel down and away from our body. So all these little extra cues are going to help activate the posterior chain. We're then going to take a big breath in, brace, and then we're going to lift this leg ever so slightly and lift the head. Now as you lift the head, you want to make sure that the chin remains tucked. Don't do this. Keep that chin tucked in. And there should be just enough room to get, a couple of pieces of paper in underneath your head. Now you're going to maintain that brace while you're doing this. If at any point it feels like the brace is going to go, Maintain, move, then exhale. Okay, so don't do any movement when you don't have that brace engaged. So again, quick run through. Head up, chin tucked, arms down straight, thumbs out, shoulder blades down. Screw the opposite leg into the floor, push the heel away, lift, lift, maintain your brace. And down, and exhale. If you've enjoyed this video, please give it a thumbs up. If you have any questions or queries, or if you have any ideas for other content you would like to see, please put them in the comments down below. Please also remember to subscribe to my channel either here or here, and please feel free to share this content.